and then I shall share the presentation. And Chloe, if you could start recording, that'd be brilliant. Okay, does everybody have that up on their screen?
Yeah, thanks. Are you going to make it into a presentation? Thank you, brilliant.
Yes, that come up.
It has. There's a hand up, Beth. John has got his hand up. I don't know if we wanted to pick that up or wait till the end, whether that's an erroneous. Oh, it looks like it might have been an erroneous hand.
Oh, okay.
Yeah, it's tricky with the things across the top, isn't it? It used to be that it hovered over hands. Now, as soon as you go near it, it seems to put your hand up. Morning, everybody. My name's Kate Brown. I'm the Director of Joint Commissioning and Community Development at Derby and Derbyshire Integrated Care Board. Hopefully people know now that that's the organisation that replaced the clinical commissioning groups as of July last year as part of creating integrated care systems. And we're here today to talk to you about an integrated care strategy that we're working on currently. And we wanted to update you as to where that's come from, where we're at with it, and also engagement and approach going forward. Just wanted to check that Ian's on the call.
Yeah, hi Kate.
Yeah,
hello.
Do you want to introduce yourself, Ian, before I start on the first part of the presentation?
Yeah, hello everyone. My name is Ian Hall. I'm working with Kate and colleagues from across Derby and Derbyshire on helping to develop the integrated care strategy. Nice to meet you all.
And it's important to say that the strategy is very much a partnership development and initiative, and we're working with a multi-agency group to develop it, and it's the responsibility of the Integrated Care Partnership, which is a structure within the system that brings together council leaders, NHS execs, Health Watch, voluntary sector, and a range of partners from health and local authority to work together. If we get the first slide, please. In terms of, you'll have already heard, I've probably said the word integrated about 5 times already, and it's littered in all of our names and all the documents you'll see coming out of health and care at the moment. And so we thought it might be helpful to just to talk about what do we mean when we talk about that. It's in recognition of the fact that people are living longer with multiple complex long-term conditions. So although people live longer, we know they live often longer time with ill health, and increasingly require long-term support from different services and professionals. And so the care needs to be joined up to respond to needs. But it's not just about multiple complex long-term conditions. It's about joining up services, joining up our approaches across all of the services and the way we meet needs. But at the moment, people can too often receive fragmented care from services, and we'll have all had examples of that. We'll also have had examples where care's brilliant and very joined up, and often at quite local levels, the way people work in communities and with the teams around them, it can be fantastic. But sometimes the systems, processes, how the resources are distributed can mitigate against people really working effectively to give that joined up response to need. So that all impacts on people's experience of care. It also can lead to poorer outcomes. It means things are often duplicated and inefficient, and people experience that. And again, we will have all have done that, where the data has to be repeated, that people aren't joined up, there isn't consistency about the message somebody gets about the care or what's going to happen next, how that's going to be organised, and it just isn't as effective as it could be. So the ambition then is about continuing on our journey to join up support to better meet the needs of the population, and making sure that parts of the NHS is joined up, and that we're joining up with health and social care and communities and voluntary sector, and working with individuals and their carers in how we understand needs and respond to needs. And I very deliberately said this is sort of continuing in that journey. None of this is new. This is a journey we've been on for a long time, and the latest changes and give us another opportunity to restructure some of the system, to connect in different ways. And this strategy is as an approach to further that aim of working in those integrated ways across our Derby and Derbyshire system. Can I have the next slide, please? So the purpose of the strategy, we did get some guidance on how to develop the strategy, and one of the key things around that, often working in statutory sectors, we get guidance that comes into individual parts of the system. So the NHS will get a set of guidance, local authorities might get guidance. What was quite significant about this was that guidance is joint. It comes from a government department to all of the statutory sectors. So that in itself signals a new way forward. But in approaching it within our system, we've really tried to say, well, if we didn't have an ask, if we were having to do this ourselves, what would we focus on? How would we do it? What gaps is it filling from the multiple strategies we have across organisations and systems, and how do we build on those rather than just replicate them or come up with something in parallel? So the guidance sets out how we should work together to deliver that more joined up, preventative and person-centred care, as I've mentioned, and gives us a chance to do things differently and to think about the challenges and the potential solutions in different ways, and use our collective might to bear on those problems in different ways. So it's setting out how we can work together to improve the health of Derby and Derbyshire citizens, and how do we further the change that's needed to respond to those really significant challenges across our whole population, and that's experienced by individuals every day. And again, all the people working on this are people who live and work in our community, and this affects us all. It's not a removed and remote sort of technical approach. It's something that really matters to the people involved in working on this. Thank you. So the starting point for us thinking about the strategy and what opportunities this brings was to build on what we've got already, and we've got a great understanding of the health and care needs and drivers from work that's happened under the Joined Up Care Derbyshire work previously, when we've been building this approach to work as an integrated system. And the previous strategies drew that information from population health and from the work that people have done to talk to communities to understand needs, into thinking about how we can improve outcomes, thinking in sort of broad approaches. So how do we help our population to start well, making sure that people have healthy pregnancies, that children are safe and well, have nurturing relationships and have access to healthcare and support, and that they thrive and develop that positive and healthy relationships. And that ambition in terms of giving that great start has been within the health and wellbeing strategies for a number of years, and it's about really understanding and using this strategy to respond to that challenge. Similarly, how do we help everybody to stay well, live that healthy life, make healthy choices, protect people, so that people have good quality of life and recover well from the periods they might have of ill health or injury? And then thinking in the final section about supporting people to age well and die well, that people can feel fit, safe and secure into older age, maintain independence, which is really important in terms of being able to then recover from bouts of ill health and get home after periods in hospital and be supported to remain at home as long as people want to, and that people have personalised and comfortable supported end of life. So again, nothing new in there in terms of the ambitions that we have, but how do we use this strategy to further our response as an integrated system to those ambitions? So in the strategy, we've drawn through from those high-level priorities, and we'll come on to the sort of response to those in a moment, and Ian's going to pick that up. But our aims are then to really focus on prevention and early intervention so much, particularly over the last few years. The focus is very much on acute response, acute hospitals. We see all the time the pressure that acute services are under, and it's really difficult then to really prioritise prevention and early support to avoid ill health and improve outcomes. And it is challenging alongside the real need to make sure we're responding today to today's problems. But this strategy aims to have that longer term approach to really making sure we're looking at prevention. Similarly, understanding and addressing and responding to inequalities, both in terms of the outcomes people have when we look at population health, but also the experience people have and the access people have due to the differences in our populations. We wanted to build in an ambition about making sure that care's strength-based and personalised. Too often, particularly in health, we can focus on what's the matter with people and how we fix things, and come from a very standardised responses. And how do we try and flip some of that and build on what's important to people and communities and the families that they're part of, and how do we, where possible, where can we tailor care? And it's not always possible, but are we doing enough to think about those things, and how do we really build that as into all of the services that we offer? And finally, given this is about integrating and joining up services, how do we connect and align across our services so that we do give that care? And that might be about how we plan together, how we use our resources, how we coordinate our services, but just constantly challenging ourselves to think about how we could work differently. And that's not just working differently between statutory organisations, but working with the voluntary sector and with individuals, their carers and communities, so that we collectively are thinking about how we can improve care, improve health and outcomes for people. Ian, I think I'm passing over to you now to pick up.
Thanks, Kate. I guess the starting point as we move on to what's in the strategy is what difference will the strategy make? And we'll all be familiar with strategies and plans that sit on shelves and gather dust, and people forget about them and nothing actually happens. So we're really keen in developing this strategy. We need a strategy, we need a document, but actually to quickly focus on things that we can do differently that will make an impact to people's lives and health and care. And therefore, as part of the development process, the Integrated Care Partnership, I don't know if, Kate, you mentioned the Integrated Care Partnership. Is it worth me just mentioning who's on that?
I think it would be, yes.
Yeah, so the Integrated Care Partnership is, Kate's mentioned about the sort of governance arrangements. The Integrated Care Partnership brings together local elected members of Health Watch, the voluntary and social enterprise sector, local authority colleagues and health colleagues, and they come together formally now and had its first formal meeting last week. It's chaired by it's co-chaired by the chairs of the Health and Wellbeing Boards for Derbyshire County Council and Derby City Council. And it met for the first time formally last week. And it's the responsibility of that Integrated Care Partnership to develop this integrated care strategy. So it's got a really good, helpful, broad base of people from across Derby and Derbyshire. And it was really clear when we spoke to the colleagues on that group in later last year that, as well as having this strategy and meeting the government guidance that's been issued, wanted to have a small number of broad areas where we can focus and test and demonstrate improvement against those strategic aims that Kate's just run through. So we asked colleagues from that Integrated Care Partnership, as I say, that includes Health Watch, voluntary sector, as well as health and care colleagues, and particularly those who lead on those on areas that line up to the Start Well, Stay Well and Age Die Well groupings, what they think a priority area would look like. And we asked people such as, for Start Well, the Children and Young People's Delivery Board that we have in place. I could see Nikki Smith's on the call today. Nikki's been instrumental in developing the proposal for Start Well. And for Stay Well, we have the Directors of Public Health, for example, identifying what they think that would be a good approach. And then Kate herself, but also the Director of Adult Social Care Services for Derbyshire and the Chief Executive of Derbyshire Community Trust have been instrumental in developing the approach for the Age and Die Well grouping. But in developing these key areas of focus, what we asked them to do was to review something called the Insights document that's been developed by Beth and colleagues. And basically, this pulls together, and Beth, I may misquote this, and you may need to correct me and tell me off when I get it wrong. But basically, it's my understanding. It's a sort of recent feedback from patients, users, citizens, various groups, lots of Health Watch reports that have been commissioned over recent years, learning from the pandemic, lots of different reports. So we asked the leaders for those in developing these key areas of focus to go through those insights and use that information to help identify what are the most pressing areas that we need to focus on, as well as things such as the local authority plans that exist and are publicly available, NHS plans and documents, and things like our health and equality strategy. So we try to look really broadly at the information that's out there, and particularly from a user and citizen's perspective, in identifying these three broad areas of focus. And we had a workshop, so basically 3 suggestions were made, and I'll come on the next slide, I'll explain what those are. But we had a workshop with members from that integrated care partnership to debate whether these felt like the right areas. And again, as I say, input from VCSE sector, Health Watch, and colleagues from across the spectrum. As you'll see in a moment, the areas are very broad. And so what we want to do is, working with yourselves and people from across Derby and Derbyshire, user groups, voluntary groups, social enterprise groups, Health Watch and others, is to explore the key issues and opportunities for improvement within these areas. And so that informs the improvement plans we develop and we start to implement over the coming months. And we want to be able to describe these changes, these improvements, to making better care and more joined up care centred around the person in ways that can be easily understood and resonate with the public. There's no point in us developing stuff that doesn't land well in terms of when we talk to colleagues and the public around the county. So if you go on to the next slide, please. So these are the 3 areas of focus that we've chosen. You'll notice I keep on using this phrase areas of focus. We're not saying priorities, because we're really keen to sort of say that these aren't necessarily more important than other really important areas of health and care, such as improving services with people with a learning disability and autism, specifically some mental health interventions. We're not saying these are more important. What we're saying is that there's a really good opportunity for these 3 areas to look at how we integrate health and care services in a better way to achieve the objectives that underlie these areas. And we'll just spend a little bit of time talking about these, because these are the areas that we want to then engage in a lot more detail on as we move forward. So under Start Well, as you'll see on the slide, it says to improve outcomes and reduce inequalities in health, social, emotional and physical development of children in the early years via school readiness. And the Children's and Young People's Delivery Board will basically lead on this work, undertaking work to look at prevention and early intervention, and support that board's vision to provide a seamless health, education, social care pathway for children and young people in Derby and Derbyshire. The work will also include a focus on the most deprived elements of our population and some of the emerging priority groupings in that sort of most 20% deprived population include teenage parents, homeless families, looked after children, children born at a low birth weight, and children with special educational needs. The Derby and Derbyshire Child Health Profiles and benchmarking, that's basically some data that's available nationally, indicates the need for this priority. So it shows that Derby and Derbyshire is a little bit below where we'd expect to be for some of the indicators related to this area. And a recent community consultation undertaken by the Derby Health Inequalities Partnership, exploring perceptions of health inequalities, highlighted a key theme amongst respondents about wanting to break the cycle of poor health in their communities with a focus on children and young people's health. The way in which we'll look to measure improvement is there's a school readiness measure, and that's around the percentage of children achieving a good level of development at the end of reception. Obviously there'll be a lot more indicators, a lot more measures as well, but that's the sort of headline measure that we'll be looking to use for that. Under Stay Well, and can I just check, Nikki, because you're on the line, is there anything you want to add to that? I'm conscious that you're the expert and I'm not. So is there anything that I've misquoted or got wrong, or anything you'd like to emphasise on that one, please?
No, that's great. Thank you very much. I'm happy to pick up any questions if at the end if needed. Thank you.
Great stuff. Thank you. So on Stay Well, as you can see, it says that we want to improve prevention and early intervention for the 3 main clinical causes of ill health and early death in the joined up care Derbyshire population. That's circulatory disease, respiratory disease and cancer. So again, if I just give you a little bit more information, obviously there's bags of information around this, but I'll just sort of give a bit of a summary. We have something called a Population Health Management Steering Group, and it has people like the Directors of Public Health on it for both Derby and Derbyshire, looking at ways in which we can, working with jointly between local authorities, healthcare and other partners to improve overall population health. And they expressed a clear intention to reduce inequalities in outcomes, experience and access. For example, identifying groups experiencing inequality of access to preventative services. So reducing morbidity from the 3 clinical conditions selected, and as stated on the slide, through a prevention approach will reduce and manage the demand on resources required for treatment of later stage disease. So this will help the health and care system if we can see people earlier. There'll be a focus through this work on modifiable behaviours for both mortality and morbidity. And what do we mean by that? Well, we mean things such as the highest impact causes, if you like. So that's tobacco, high blood pressure, dietary risks, high body mass index are some of the key telling things that we know that if we can modify behaviours to affect those areas, then we should see an improvement in prevention and early intervention for those 3 disease areas. And we know that preventing ill health is beneficial for the population well-being and reduces demand for NHS services. So, for example, preventative interventions such as cardiac rehabilitation has been shown to reduce admissions, and early cancer diagnosis leads to increased survival and reduces the overall impact and financial impact both on healthcare resources, but obviously on an individual's ability to work and support the family. And again, just thinking about local insights, how have we used local insights to identify prevention as a priority? Well, from one of the reports that we looked at, we know that people welcome the move to focusing on the wider determinants of health, but feel that priorities still reflect improvements in services rather than wealth, education and prevention. So we're obviously always juggling with this, you know, this dilemma. Do we put more resources into services that treat patients, or do we put more resources into services that help prevent and early intervention? And obviously we'd like to do both as much as we possibly can, but there's always this balancing act given we have finite resources. And so if we go on to the 3rd area, which is age and die well, and you can see that again on the screen, it says that we were going to enable older people to live healthy, independent lives at their normal place of residence for as long as possible. We want to see integrated and strength-based services that will prioritise health and well-being, and when people have a crisis, that we help them to remain at home where that's possible and maximise a return to independence following those crises or escalations. So basically the key ambition here is about maintaining functioning and independence, and we know that a focus on prevention and proactive identification of people and effective care planning is really the best approach to supporting patients and carers who have the most complex needs, because this enables them to take an active part in their decisions concerning their health and well-being and subsequently the demand for health and social care services. But when more critical episodes of care do occur, it is necessary to have responsive integrated community provision available so that acute admissions into acute hospitals only happen when it's the best option, not because it's the only option. The main vehicle for improving outcomes in this priority area will be building integrated local planning, service responses and supporting the community. There are a number of measures underpinning this area of work. I won't go through all of them on the call today, but they're sort of grouped really under improving health and well-being, enhancing the quality of care and enhancing the value and sustainability of services we provide. And this selection builds on engagement with the population over a number of years, which has identified themes in terms of what's important to them to keep them well. So Derbyshire people have identified being able to stay in their home for as long as it's safe to do so as one of the most important things to help them keep their independence and stay healthy as they get older. So that was really, sorry for taking a bit of time out. I thought it'd be helpful just to sort of explain and expand a little bit on the background to both the selection of these areas of focus, but also sort of what sits a little bit behind them. Go on to the next slide, please. I can see lots of things in the chat box. If I just sorry, I'm not being ignorant. If I just carry on and go through the slides, and then working with Beth, we'll go through the questions in the chat box, if that's okay. So first of all, the draft strategy is available. I've put the link into the slide. It was presented through the Derby City Council Chamber last Wednesday. Again, I think that's recorded on YouTube. All the papers for the Integrated Care Partnership meeting are publicly available, so anyone can access the draft strategy. And obviously, Kate and I have sort of quoted various bits from it this morning. It includes a suggested approach to engagement, and we'll pick up that up on the next slide. And really what I want to do is hear your views starting this morning on some of the suggestions for engagement. Next slide, please. So this will form the nub of some of the conversation for the rest of the time this morning, but also moving forward. And Beth will be able to explain some of this better than I might be able to, or if I get stuck. But basically, we want to do a number of things. So for each of those 3 key areas of focus, as well as having a generic conversation like today, and we're very happy to do this as often as is useful, we also want to have conversations with people about those 3 areas I've just run through. So we're arranging for leads from those 3 areas to present information in an accessible way and invite comments about what actions are needed to achieve the ambitions set out, and to capture these to inform our action plans as we move forward. We've got online engagement platforms set up to be able to support this, with the opportunity to ask questions and make suggestions. We can do surveys, although we realise that sometimes there's a bit of there might be survey fatigue. So we want to again ask people's views on how useful surveys can be and how we can target those surveys to make them most useful. But we also want to facilitate and support direct conversations between leads for those 3 areas and local community groups who express an interest in those areas of focus. Helping to ensure we do this will mean we don't just rely on digital access. We're very, very cognizant of the possibility of digital exclusion. Not everyone is either comfortable or able to access things digitally. So we need to make sure, and you need to tell us if we aren't being as fair to people without digital access as to those that have. Now, clearly, this morning people have got digital access because they're on a Teams call this morning, but I'm sure you'll know people in your communities who don't, and it's really important that we're able to engage with those on an equal basis. And we look to use existing groups and forums where possible, not exclusively, but if those forums exist. And we've already got a really strong commitment from colleagues from the voluntary community and social enterprise sector, and the alliance that has been brought together to across those organisations, led by an individual called Wyn Garnett. We've got a commitment to work with the VCSE Alliance to be able to help us access those groups that will be wanting to take part in this process. And we need to ensure that feedback insight from all these conversations is listened to, considered, and actions through the implementation plans for the 3 key areas of focus. Next slide, please. Oh, that's it. Sorry. So we'll move on to Q&A. We'd really like to hear your views, and both generically in terms of the strategy, but also specifically in terms of the areas of focus. And then as the conversation moves on, specifically about the ways in which we engage and ensure participation. Our aim is to do something different, I guess, with this strategy, and to have engagement driving the action plans rather than sometimes the other way around. So really keen to get your views. So I'll hand back to yourself, Beth, and how very happy for if Kate and I try and pick up some of the comments in the chat box if relevant. But how do you want to do the next bit?
If we go to Chloe first, Chloe, is there any questions that you can pick up in the chat box that we can bring, and then I'll make a note of people with their hands up and go through that. So Chloe.
Hiya, yeah, just a couple of questions. I think both of them about timescales. What's the timescale that's going to happen? Obviously a lot of reorganisation in the NHS. So yeah, just a bit about timescales for that.
Shall I pick up the one, the comment about I think was it Patricia, about how long it's all going to take, and whenever there are changes, there's talk. And I completely understand the perhaps even a bit of cynicism about the reorganisations that have happened in the NHS. I'd want to emphasise that this isn't a reorganisation. I think sometimes in the past where there's big organisational changes, that can almost pause progress. That isn't the case with this. So it's about bringing together through the integrated care system those strategies and partnerships, and it's about trying to then accelerate the pace of change rather than pause or slow anything down. So I'd want to reassure about the fact that that isn't isn't a risk at this point in time. In terms of timescales, and linked to Anne's question as well, it's really hard to set timescales, because when's this ever finished? It's a complete work in progress, isn't it? I'd hope that people are seeing now some improvements in services, and whilst there might be elements where, when we know we've got a long way to go, that some of the things we're trying to do to join up services and neighbourhood teams in communities, the response we give to crisis in communities, for example, that people are seeing that there's a bit more joined up. So it's about the pace at which we can do some of that, and within the delivery plans for the elements that Ian's talked about, we'll be setting what those ambitions are and the timescales by which we can achieve those, and also wanting to hear how
the means by which they tell people.
We're wanting to hear how that's going, because the comment there about people often say they didn't experience that, how we can feed that in and listen to that, and we're working with some organisations about how we could capture that information that says, is this integration approach making any difference, and if it's not, how do we respond to that, rather than looking at some of the traditional ways of measuring improvement, which would be about data and some of the normal things that we measure as statutory organisations. So just say that quickly before we move into the questions that I can see people have got their hands up for, Beth.
Wonderful, thanks, Kate. Yeah, if we just go through people with their hands up, if I come to Neil, then Lisa, then Andy, and then Chloe, if you just keep an eye on the chat, and we'll come back to questions after when we've gone through everyone with their hands up. So Neil, do you want to go first?
Yes, thank you. Good morning, everybody. I'm Neil Malden from Derbyshire Dialogue CVS. I was just thinking that a lot of what you were talking about there is prevention, and actually, of course, that's largely a public health function, isn't it? And public health was split off from the health services, effectively, and put into local authorities. So I just wonder how you're working alongside public health to deliver this.
Really great question, Neil. And actually, prevention isn't public health. So, like you say, in terms of one of the things we understand is about the different elements of prevention. So certainly primary prevention, you're absolutely right, public health. But in terms of secondary prevention, i.e. people that are in the system, and tertiary prevention, about where you might not be able to stop something happening, but how do you reduce the exacerbations, is very much the domain of health. And one of the things that we've looked at as part of developing this strategy is often we've got a lot of great information from public health, but it's not always been translated into actions for the different organisations. So that stay well section in the middle is very much driven by the two directors of public health for city and county, and colleagues who lead on population health in multiple roles within our organisation. And the ask we've put to them is, tell us what we need to do, tell us what the different organisations' response needs to be. So it isn't just a thing that's in public health and isn't public health reports, it's actually something that we embed into how we deliver care as well. So great point, and it's something the strategy is really wanting to focus on and draw through, because that has been a gap historically. I think you're right, when it moved over to local authorities, that some of that disconnected a little bit, and this tries to bring it back together.
Okay, thank you, Kate.
Thanks for that question, Neil. I've got Lisa, Andy, Richard. I've noted you down just to speak after Andy, but can we hear from Lisa next, please?
Thank you. Yeah, thanks for that presentation. I'm Lisa Whittam, and I'm from Derbyshire Wildlife Trust, and I also work on a green social prescribing programme called Green Spring. So I was really pleased to see personalisation in there as well, and prevention, but it was just sort of following on from Neil's question, really, which we've spent sort of 2 years doing a green social prescribing programme, which the impact and the effects of which will not be seen for, you know, maybe 5 to 10 years, around kind of getting people outdoors in nature and being more physically active. And it was just about how sort of challenging it's been, really, to find people who would sort of come on board with us and who would support it and influence it. So it was about sort of the challenges around, we find that often people are, and I completely understand this, are wrapped up in urgent crises that need to be dealt with immediately. So that idea of sort of investing in something that isn't going to see any impact or outcomes for 10 years has been really challenging for people to kind of look at. So I was just sort of thinking if you could expand on the broader context of that, and I'm pleased that that's a focus of the strategy. And then my second point on that was about VCSE engagement. So I'm involved in a few things at the moment where they're talking about, you know, communities and making sure that the population and residents are represented and their voices are heard. And I think a lot of the work that's going on is duplicating some of that at the moment. But my word of caution, if you like, would be sometimes at some of these forums and networking events, we just see the same larger voluntary and community organisations who sit around the table, and that's because they have the resource and they have the time to be able to go to these meetings. So I would just sort of, you know, like to see very community-based engagement happening over the next sort of iterations of this strategy. Thank you.
I'll respond quickly to that. Delighted that you feel the Green Springs being successful. Louise, I'm sure you know Louise Swain is in my team, who's really supported from the NHS perspective that programme, and I think that's a great example about partners working together to draw that resource into the city and the county to deliver against that challenge. It was about 500,000, wasn't it, over 2 years? And I think that's, we have to learn from where we've managed to do that, and how do we do more of that together, where you get the partners working around the table, putting in a proposal like that to national resources, and then really trying to build on that at a local level. So I think examples like the Green Spring are what we would want to be looking at how we can do more of as partners together. So I think it is really challenging to make the case for that really upstream investment. But I think things like that, where we can draw in resource and build on those opportunities, are where we've got to focus, and easier to do that with all the partners around the table working together, rather than historically where there'd be individual bidding processes. And I think in terms of about larger organisations and VCSE, I'm sure colleagues on the call here are involved in the VCSE Alliance, and we'd take that on board about how to then make sure we're really reaching out to all of the sector, and not just as I say, some of the organisations that might be more able to be representative in forums. So points well made, thank you, and really noted.
And next we've got a question from Andy.
Hello, good morning. Very well done, thank you very much. I noticed, or I heard it was all inwards looking in terms of the county. I live in the bottom of the county, and not all NHS services are available within the county boundary. Some of them we have to go outside the county boundary for. For instance, my father-in-law had a fall and suffered severe scalds, and the burns unit was Nottingham City Hospital. So coming out of there back into a Derby home, the interface didn't work at all well in terms of the joined up care. So how are we looking at around the fringes of Derby and Derbyshire to get the joined up care integrated with just on the outside of it?
Thank you. Some of those specialist services, particularly where they are very specialist services, they are regionally offered, and that'll be the case with burns. It's not viable to have that expertise in every health system. I think those pathways of care and that interface, it's not something we're looking at within this integrated care strategy, but I think it's something we would need to flag with the systems within Derbyshire across those specialist services. So if there were gaps in transfers of care and joining up across a very specialist clinical pathway, I think we'd need to flag that with the relevant organisations and the receiving organisations in Derbyshire. So it's not something that's been raised with us previously. So happy to look into that and to think about how what work's going on to make sure those pathways are as smooth as possible, noting that sometimes people will need to go out of Derby and Derbyshire for specialist care.
Yeah, I'm sure burns and scalds are just one example, and there's probably others. Yeah. And it's something that as part of the outward-looking joined-up care, Derby and Derbyshire, we need to look at?
I think it's a great point, Andy, and whilst we are linking in, so I'm sort of reaching out to make sure we know what's in Nottingham's strategy, because each area is doing a strategy, and I think it's a great point, actually. So we get down to those specific areas about how we do that better, and I think we should reflect on that, Kate, and think about that as being one of the areas for each. Certainly 3 key areas of focus we're looking at is what's in county and what's out of county, and making sure the links are in place. Thank you very much.
Okay.
Yeah, thanks for that, Andy. Really good point made. Richard, we'll come to you next, and then Chloe will check in on the chat. Richard?
Right. I failed to spot housing and the police and law and order. I see that we noted we want people to stop in their own homes in the later part of their life. But what happens if that house is not really suitable? And at the other end of the scale, we have to return back to the days of mouldy housing, and it took a coroner's report to wake anybody up to mould in housing. Whose problem is that? Is that a medical problem? Is that included in the integrated care? I didn't spot the word housing. I noticed a lot of integration, but they're faceless elements in the process. And the same with law and order. All very well living in a nice house when there's 25 drug addicts and drug dealers outside your front door. It's all part of the same thing, isn't it? Somebody somewhere has to look at management of health, and it's not just going to the doctor, nor to the hospital, nor having somebody knocking on your door offering to make you tea. It's about where you live, what it's like to live there, and can you live there safely and comfortably? Or can you go out? Some people won't go out. They're frightened stiff to go out because they think they're going to catch something, or they're going to be attacked. That is really part of health, isn't it? It's
Yep.
this underlying well-being, I suppose it was called in my young day, and I suppose it's still called the same thing. But I didn't notice housing and police and that included in the strategy.
Yeah, thanks for that, Richard. We'll just hand it over to Kate or Ian just to get an answer.
Yeah, thank you for that point, Richard. And I think there's wider determinants. I think that we use the term wider determinants, and housing would certainly be there in terms of one of the things that massively can influence people's health and experience of care. What we're, as Sue's helpfully put, I don't know if you can see the chat, that we have a health and housing group, and in fact there's one of those meeting this afternoon where partners come together to look exactly the issues you're talking about the impact of housing on health in multiple ways. This strategy, as we've said at the start, isn't aiming to replicate everything that's existing or draw on everything or write a strategy that says we're going to cover absolutely everything. It's about trying to think about the additional areas where we need to bring focus. So work is going on health and housing, and more going on around health and housing and how we work together and how we link in multiple ways around that exact point that you've made. And the health and wellbeing boards have responsibilities around broader, wider determinants, and that work is carrying on. This is aiming to supplement and build on that work. So some of the things you're talking about there about crime as well, and education, they come together in those health and wellbeing partnerships that the local authorities and health work together on as well. So this is about supplementing and building on some of that, not replicating that. So it is happening, it's just not replicated through into this strategy.
Okay, thanks for that, Kate. Chloe, we're going to just check in if there's any questions coming out the chat group before we carry on with the hands up.
Yeah, I think there's been a few comments. Thank you, Kate and Ian, for kind of responding and acknowledging them. There was just one by Rita. So she's asked, are there enough staff in the community to deliver this care? And if not, what are your plans to recruit the right people to enable delivery of this care?
Really great point. One of in terms of workforce. So one of the issues we've looked at when we were developing the strategy was about what's stopping us doing any of this now, and the comment earlier about why don't we just get on with it. And what we found was around the fact that it's those things that enable, it might be about how we use our resources, how we make decisions, and workforce came through as one of the biggest, key areas. We know that there are massive challenges, and sometimes there's not enough money, and sometimes there's money but there's not enough people. And so continually services are looking, and part of working as an integrated team can enable people to think differently about how those needs could be met, and have a different sort of almost like a skill mix. So could you have a different range of people and different grades of people? Is it easier to recruit at certain levels? And there's work also going on really targeting people who might not think about health and care as a workplace, trying to look at how you could encourage them in, think about different apprenticeships, so have that flow of people coming into the sector, because we know it's really challenging, and everybody will have seen nationally about how it's very difficult to compete with the shops and hospitality in terms of some of the roles, and people as well will be aware about the national challenges about the pay grades and making that attractive. So we can't control those things, but in Derbyshire we can do what we can to try and encourage people into the workforce, making it great places to work, making teams really good teams to work in, and having joined up. The staff tell us working in joined up ways and having data that's shared, etc., makes it a better place. So we want to retain the staff we've got, recruit people in, and use people in as imaginative ways as we can to meet need. But it is really challenging. So it's a key strand. When the strategy, you'll see it's got sections on those key enablers, and workforce is in there about the way we're going to develop those plans and continue to try and tackle those really difficult challenges.
Thanks, Kate. I'm just conscious of time as well. We've got 10 minutes, so we'll have probably about 5 more minutes of questions, and then we'll start rounding up and just carry on to the rest of the agenda. So I've got Cass next.
Hello. I'm new to this, so if I'm going to ask stupid questions, please excuse me. But with the start well, I noticed, I was just wondering, is community health still in existence with the school health and the baby clinics? And if so, are they being used to the full potential with the school health doctors and nurses and so on? And the buildings, are there any of the buildings still in existence? Because I remember years ago, community health had access to ENT at the DRI, and they used to run a clinic from there. And you were talking about the burns unit, and I was wondering if you still got these facilities, could you not make use and share the expertise, bringing some of it into Derby? If you've got some of these experts, could they not come into the Derby area to be showing our staff how to deal with these problems, like the ENT clinic, where we had access to the consultants once a month? Also, I am concerned because you've got all these fantastic ideas. I think they're absolutely brilliant, but I do worry about where the funding is going to come from, especially with the fact that the health service has been underfunded for at least 30 years that I know of. I know this for a fact, and I'm just thinking, well, where is all this finance going to come from for all these wonderful ideas?
Thank you, Kath. I'll hand it over to Kate, or did Nikki want us to come in on around the children area?
Yeah, if Nikki's still with us, she's probably best to respond to the specific questions about current services. Nikki, do you want to come in on that first?
Yeah, that's fine. Yeah, hi everyone. Yeah, so I think that there was a few things that I picked up in that. So we do still have health visitor services, so and GPs still do newborn checks. There's still support available through that. So I think that was the first question. Does that still happen? We do still have children's hubs, and there are also family hubs, which Derby City are linked into a national programme to create some of those, and we've been linked in with colleagues there to make sure we maximise the buildings and the space that's available to us, and create those links. I think there's a recognition that if we sit people in the same building, it really does help in terms of strengthening the links across services. I hope that covers the first bit. If not, I'm happy to backtrack. The bit about finance, yeah, finance is always a problem, but I think a lot of it is about how we work together with what we've already got, and we're not particularly great at that, and that's what we really need to improve. The focus on early help and early support, we hope, means that the specialist and the more expensive support that's needed later on won't be needed at the level that it's at the moment. So there is something about trying to refocus our the way we spend our money to maximise the support that we can offer at the earliest opportunity. I'm sure finance will be an issue and a challenge. I'm not pretending it's not going to be. Thank you. I hope that's okay.
That's what my main concern is, because like you're saying about the GPs providing this service, well, I know also I've been reading recently where GPs have been becoming millionaires through privatisation and consultants. And I do think that this is something that should be kept within the NHS, so that, like with community health, you had doctors that specialised in child health that were employed by the NHS, and it was not being funded outside and paying GPs extra. Immunisation, the lot, used to be done in service, not pushed out. It's more expensive to be paying an independent person than it is to have your own staff. That's one saving.
Thanks. Thank you for everybody for your comments there. I am going to have to draw the questions and answer session just to a close. I do apologise to Tony, Anne and John. We've not been able to get to you, but what I can offer is if you put your question in the chat, or Chloe, if you pop our email and contact details in the chat group, so please get your question to us and we will respond to you. And any other questions that we've not picked up or answered in the chat box, we will also get back to everybody. I just wanted to briefly talk about the next steps as well, just before obviously our time runs out. What we'll do after this session is this session will is recorded, and we will send out a link to that recording to everybody. We will also send out any questions that haven't been answered as well within the session, and just get those answered as well. The next steps obviously are the strategy obviously will get developed. Obviously we'll get to feed in the feedback as well, but on all those three key areas of focus we'll be looking at doing further engagement, and these engagements are just the start of a conversation. This isn't just like a one-off shop that we're doing. So we will be developing with the leads of each of those three areas different methods and different approaches to speak to people in more detail, touching on some of the ideas that Ian spoke about earlier. So looking at maybe doing some more live sessions like this and having further debates, and potentially looking at maybe developing surveys, but this will be an ongoing discussion and we want to involve everybody within that development as well. So I will keep everybody updated either via emails or social medias or whatever current method you prefer on your communication. And just want to let you know as well, we're actually doing a review of the Derbyshire Dialogue, so this actual event that we're doing now. It was actually made during COVID just to keep people informed about what was happening in different health services, but obviously that the situation's evolved now, but we also think this is a really good platform to keep discussions going. But we're really interested to see what people want to use this platform for and what people want to hear on this platform as well. So I see my colleagues are just putting the links in the chat box as well, so please, that survey is open to the end of the month, and then I'll be looking and then developing over the next year this actual platform as well, so your comments will be really welcomed as well. So I just want to thank everybody for coming today. It's So really appreciated. And thank you to Kate and Ian and Nikki as well for the presentation and feedback as well. And I'll draw the meeting to a close. So thank you everybody for your time.
Thank you.
Thank you.